Hi, I'm Bella, and I will be explaining diversity in healthcare specifically in the Netherlands. The Netherlands uses a healthcare model known as the Bismarck model. The Bismarck model is a healthcare model founded in Germany by Otto von Bismarck. Healthcare under this system is paid for by nonprofit insurance firms and given by private and public institutions. Essentially, employers and employees often fund health insurance by deducting employees' pay. Employees are then given sickness funds to use for their health care. Governments under this model tightly control prices of healthcare, leaving insurers to make little to no profit. The Bismarck model is similar to that of the United States in the aspects that the United States has similar employee healthcare benefits as those under the model. The Bismarck system also has similar aspects to Medicare that is offered by the United States government. Here is a short video on how the Netherlands specifically uses the Bismarck system and on how Dutch healthcare works in general.
Used by the
In the Netherlands, everyone has a right to healthcare when they are ill. As a resident of the Netherlands, you are obligated to have health insurance. For that health insurance, you pay a monthly fee. That is called an insurance premium. How does the healthcare system work? And where should you go to when you have a health issue? In healthcare, we have 4 lines of care. The 0th up to the 3rd line. The 0th line of care comes to you automatically. The goal of this kind of care is to prevent people in the Netherlands from becoming ill. Examples include the Dutch Public Health Service GGD and the Center for Youth and Family, also known as Consultatiebureau. You don't have to do anything. You will automatically receive a letter for a vaccination or screening. The first line of care includes your general practitioner, as well as pharmacies, midwives, dentists, and physical therapists. For this kind of care, you have to make an appointment or visit the medical professional yourself. You do not need a referral from your GP. The second line of care is healthcare at a hospital provided by e.g. a lung specialist, gynecologist, cardiologist, or other specialist. That is also known as specialized healthcare. For an appointment with a specialist, you will need a referral. That is why you first have to visit your GP to get this letter of referral. The third line of care is long-term exceptional care. That could be a stay at a rehabilitation center or health care at a teaching hospital. For this type of care, you will also need a referral. In the case of an emergency, always contact your GP first. If they are unavailable, call your nearest after-hours medical clinic. If you are in an acute, life-threatening situation, call 112 immediately. So, if you are ill, start at the first line of care. That is how the healthcare system works.
The Bismarck model has plenty of concerns and issues, though, that should be considered. To start, it was not originally intended to provide universal health care coverage, essentially meaning that under the model, health care is more seen as a privilege than a right. This means most of the healthcare resources are prioritized to those who do contribute to financing the plan. So those who can't work or struggle to contribute financially aren't prioritized in receiving healthcare and coverage. The model also faces concerns with the issue of the aging population. As more and more people are retiring, there is less healthcare coverage for them due to them not being employed, when they are typically the ones that need it the most. Finding ways to cover unemployed or retired people is a common problem under the Bismarck model. These next slides are comparisons of public health statistics in some of the countries that share the Bismarck model. As an overview, the Netherlands' average life expectancy is an average of 81.6 years, while their infant mortality rate is 3.58 infant deaths per every 1,000 live births. And finally, they have an average of 3.7 physicians for every 1,000 people. Germany, in comparison, has a slightly lower life expectancy of 80.94 years. Meanwhile, they have a lower infant mortality rate of 3.10 infant deaths per every 1,000 live births. Finally, the physicians per 1,000 people is slightly higher than the Netherlands, with an average of 4.3 physicians per 1,000 people. In France, their life expectancy is higher, with an average of 82.18 years. Their infant mortality rates are also slightly lower, with an average of 3.45 infant deaths per every 1,000 live births. Finally, their physicians per 1,000 rate is almost double that of the Netherlands, with an average of 6.5 physicians for every 1,000 people. In Japan, their average life expectancy rate is 3 years higher than the Netherlands, with an average life expectancy of 84.62 years. Their infant mortality rate is also half of that of the Netherlands, with an average of 1.82 infant deaths per 1,000 live births. But their physicians per 1,000 people is over one full physician less than that of the Netherlands, with a rate of 2.5 physicians per every 1,000 people. Finally, in Belgium, their life expectancy is slightly lower to that of the Netherlands, with an average of 80.8 years. But they do have a slightly lower infant mortality rate, with an average of 3.44 infant deaths per every 1,000 live births. Their physician per 1,000 rate is an average of 6 physicians for every 1,000 people. The Dutch culture is the largest and most prominent culture in the Netherlands. Dutch people are often known to crowd around each other and don't have a huge emphasis on personal space. They have a preference for being close to one another while interacting. So when a healthcare professional is delivering care to a Dutch patient, they should keep a safe distance, but also not be too far that is seen as disrespectful. Dutch people are also very direct in their conversation and typically prefer to get more direct answers. They also value the honesty that they get from their conversations. Healthcare professionals can best respect these cultural differences by giving patients direct and less circumlocutive responses, while also staying completely truthful to be respectful of their beliefs and values. Also, being punctual and on time is valued largely in Dutch culture. A healthcare professional could respect this value by trying to be as on time as possible with their patients or apologizing directly for being late. Also, staying timely in a healthcare professional's time with the patient could be a better sign of respect. A healthcare professional could also consider a few other things while treating a Dutch patient, like knocking on a closed door before entering, standing in a focused position without hands in your pocket or without your arms crossed, maintaining eye contact, and using greetings, physical and verbal, if safe, before each conversation, which are all things valued in Dutch culture. The Frisian culture is a minority cultural group in the northern Netherlands. The Frisians mostly speak their own native language, though most are bilingual in Dutch or English. But it would be important for a healthcare professional to ask someone if they would prefer a translator or to receive their healthcare information in their native or another language. A healthcare professional should also have a translator on hand to help with this. The Frisian people are also stereotypically known to be very hesitant to change their ways, beliefs, or lives, though this shouldn't be expected for all that consider themselves to be Frisian, because it is just a stereotype. But typically they are known for sticking to their ways and values. For a healthcare professional to best care for a Frisian patient, they should accept and acknowledge the patient's possible resistance to a professional's help, but not consider all patients that are Frisian to be this way. But they also might need to know that to give patients more convincing than normal when giving them instructions or convincing them to do something, while still maintaining respect of their values. The Frisians are also known to be very proud of their culture and hard work. A healthcare professional should accept this pride and be supportive of it if a Frisian patient is showing their pride in their culture. They should never undermine a patient's cultural differences, no matter if they are similar or different to the healthcare professionals. Another minority cultural group in the Netherlands is the Surinamese people. The Surinamese culture incorporates aspects of European, Asian, and African cultures. In Surinamese culture, an important aspect is a respect for elders, which is taught from a young age. A healthcare professional treating a Surinamese person should keep respect for elders in mind. And if a patient is older than the healthcare professional or older in general, they should give an extra amount of respect to respect this cultural value. Another part of the culture is the physical touch in their greetings. Typically in Surinamese culture, people often hug or shake hands while greeting someone. A healthcare professional treating a Surinamese patient could try to respect this belief by safely giving more physical greetings, though remembering to keep in mind that some patients might not like that even if they consider themselves Surinamese. A healthcare professional, though, could offer their hand out for a handshake, if it is safe to do so. There is also a variety of religions that are practiced in the Surinamese community. The three main religions are Christianity, Hinduism, and Islam. These religious differences offer differences in a patient's medical preferences. For example, in Islam, most Muslim people have a preference for having the same gender doctor as them. Specifically, women prefer to have women doctors or other healthcare professionals. They are also sometimes more accepting of death and could possibly reject life-saving treatment, though it is important to remember that not all Muslim people have the same exact values. Hindu patients often prefer to have their family more involved in their treatment process, may have to fast on certain days or holidays for religious reasons, and can sometimes also be more accepting of death. But a doctor or healthcare professional should remember this, but not expect all Hindu patients to follow these values. When a healthcare professional cares for a Surinamese patient, they should keep in mind the variety of religions and the cultural practices that each religion prefers. They could also ask a Surinamese patient about their healthcare preferences to give the patient the best care and make them the most comfortable. There's a lot of ways to respect the cultural differences in the Netherlands and in other countries as well. As a healthcare professional, you should always ask your patient what their healthcare preferences are. These can include the gender of their healthcare provider, what language is spoken, or if a translator is necessary, and how much physical touch or personal space should be given in order to make the patient most comfortable. You should also know the common cultural differences in the country that you practice in. In the Netherlands, this is typically the Dutch, Frisian, and the Surinamese people, though there are some other minority cultural groups. Specifically, in the Netherlands, you should typically use close physical contact or physical greetings such as handshakes with patients, if it is safe to do so. You should also remember to be punctual and try not to be late. And if you are, be apologetic for tardiness of any kind. Also, stay direct in your conversations and retain eye contact as it is seen as a sign of respect, while also still maintaining politeness. By utilizing these techniques, the cultural differences in the Netherlands can be respected, which is necessary to give patients the best possible outcomes and make them feel the most comfortable. Thank you.